and groin pain is really quite common. We see a lot of it in clinic, and I think one of the reasons is that many different problems can present as hip and groin pain. So it may be a localized problem or something coming from the back, different causes that we explore. So we do see a lot of it. And the key thing really with hip and groin pain, like anything in medicine, is to get an accurate diagnosis, either with clinical examination or investigations and scans that we might want to do. Because once we have that diagnosis, then we can look at the treatment options and decide what's going to be best in terms of getting a patient better from that particular problem that they have. So one of the first things we need to do when anybody presents with hip or groin pain is to discover if it may be referred pain that's being felt in the hip or groin. So we need to always rule out a referred pain from the lumbar spine. So anything like a disc or that could be pressing on a nerve that's referring pain into the hip or groin area, we need to consider that with the history and clinical testing. And if we're happy it's not that, then we really focus on more localized causes of hip and groin pain. And probably the major one would be something within the hip joint itself. In terms of what may be going on in the hip joint, perhaps in a slightly older population, although we do see it in younger age groups as well, is something like osteoarthritis of the hip, which is a localized sort of bony problem within the hip joint. And in younger patients, we can see a condition known as femoroacetabular hip impingement, or for short, we may call it hip impingement. And that's where you can get hip or groin pain with sporting activity, usually in a younger population. So outside of the actual hip joint, one of the other causes or group of causes of groin and hip pain are basically soft tissue problems, which would include ligaments, tendon, and possible muscle injury. And probably the most common is tendon. And there's two real tendon issues we commonly see around the hip. One is on the outside of the hip, involving what we call the gluteal tendons. And people sometimes refer to that partly as trochanteric bursitis, which many patients have heard of. So that's a common problem that we see. And the other one is something like a hip flexor problem in the very front of the hip, whereby patients with exercise often can get tightness and pain in the front of the hip joint. The other causes really of soft tissue are anything around the pelvic area. And one of the other things we need to make sure a patient doesn't have is something like a hernia. Now, hernias are often obvious clinically. So if it's a bulge or something, it's very easy to diagnose, but sometimes there are subtle hernias that are not obvious visibly, and that can lead to the need for investigations or scans if we need to do that in a particular patient to help diagnose that problem. I think really important, as we said, is to get a diagnosis, because then we can plan the treatment. So it may either be reviewed with one of the physiotherapists or one of the sports and exercise medicine consultants, such as myself. And we clinically assess the patient, and sometimes we'll consider the need for investigations. And that may include a diagnostic ultrasound scan, which the sports and exercise consultants here, such as myself, do in clinic. So we're trained in ultrasound scanning. If it's needed, we'll refer off to one of the other clinics for x-rays or MRI scan. MRI giving more detail in bone or cartilage around the hip joint and things like that. So the investigation is determined really by what we think the possible cause is, and it's often necessary, not always, but usually a scan will help us to confirm what we're considering as the likely diagnosis. And then we need to look at the evidence for the best treatment for that particular patient. And we're really fortunate, and we have the setup at Pure Sports Medicine. We have the multidisciplinary team known as the MDT, and that includes physiotherapists, soft tissue therapists, osteopaths, strength and conditioning coaches, the list goes on, but essentially we work together within the team to get the best possible outcome for that patient, ultimately trying to get the patient back to their goals, be it running or whatever exercise or daily activity that they're being prevented from doing.